Welcome to In-Time TV's On the Edge, Conversations in Emerging Medical Technologies. I'm Dr. Jonas Moses. Today I'm going to be talking with a guest about optical coherence tomography and its clinical use in the diagnosis, pathogenesis, and management of retinal disorders. I do want to give a little bit of background before we talk specifically about OCT, as it's called, and just point out that there are many, many tools that are useful in the diagnosis, treatment, and management of disease of the eye. And sometimes these tools fall short of the mark in being able to provide the kind of imaging and appreciation of detail, discrete detail, that we require when we're treating, especially in retinal disease and glaucoma. Among the imaging available to us, of course, like regular photography, ocular photography, photographs taken through the pupil of the eye at the retina, and you can use various dyes in fluorescence so that you can appreciate the vasculature as the dye is floating through the retinal vessels. However, beyond that, you have X-rays, which go mostly through tissue, so we're going to be looking at bony structures of the eye, and CT scans, and magnetic resonance imaging. However, the fine detail, the really discrete detail of retinal layers are readily missed by these. There simply isn't the resolution power required to be able to appreciate things at the micron level. So, in 1991, a team of scientists, and we'll be talking about this a little bit later, introduced a new concept and a combination of technologies, available technologies. One of them is tomography, and the idea of taking slices, images, through a tissue or a bone. And we see this in CT, computer tomography. We see it in other kinds of tomography. And we also, they also combined this with something called interferometry. And the idea behind interferometry is that you take a beam of light and you split it into two components. One of those beams goes directly to your target, what you're trying to image. The other is bounced off a series of mirrors, and when these two streams of light are recombined, the wavelengths either constructively or destructively interfere with one another, and the image at the end renders a three-dimensional it can be recovered as a three-dimensional image. So tomography and interferometry were combined to create, among other things, OCT, optical coherence tomography. Other advances, innovations in using combinations of these things, we think of in microscopy, confocal microscopy. What's important to note about OCT is that you can use a live subject. This is something that you can do non-invasively, looking through the front of the eye and actually get an image of the retina and appreciate that cross-section in real time as a almost as a histopathological slide. So I want to just put up a retina really quickly here. Do we have a picture of a retina? There you go. And if you notice the layers up in the left-hand corner of this, we are looking at the area that's called the macula and the fovea. And at the very center of the retina, as I said, is this macula lutea, or simply the macula. And the macula lutea is called lutea because of its high concentration of lutein. Lutein is one of the over 600 known naturally occurring carotenoids and is responsible for the absorption of blue light specifically. The macula allows us to see color and provides us with detailed color vision. In the very center of the macula is the area called the fovea. It's the area that contains only cone cells. Now, I do want to point out that there are rods and cones. There are two different types of receptors in the eye. These light receptors, cones are responsible for color vision, and rods are responsible for black and white and movement. We can sense at the periphery of our vision only a little bit of black and white vision and movement. When you go to the center of the eye, the part of the eye that is at the very 5 to 10 degrees from fixation, where you're looking straight ahead at something, that is the area of the fovea and the macula. We do want to talk a little bit about OCT today, and I've had the opportunity to have joining me as a guest Dr. Jennifer Lim and Dr. Jennifer I. Lim, by the way. And Dr. Lim is professor of ophthalmology and director of the retina service at the University of Illinois in Chicago at the Eye and Ear Infirmary. She received her medical degree with distinction from Northwestern University's 6-year teaching medicine, was it teaching medicine program? Is that honors program in medical education. And you did your ophthalmology residency at the University of Illinois Chicago Eye Center as well. You trained in medicine and surgery of the retina at the Wilmer Ophthalmological Institute in Baltimore, Maryland? That's correct, at Johns Hopkins. And Dr. Lim was also medical director of clinical trials at the Doheny Eye Institute from 2002 until, what, June of 2007? Right. Is that correct? You received 7 Best Doctor in America awards for ophthalmology, and you were named one of America's top ophthalmologists in 2007. Dr. Lim holds a leadership position within the American Academy of Ophthalmology, Women in Ophthalmology, and Women in Retina organizations, among others. She's co-authored and authored and co-authored over 150 articles and 12 book chapters, and has edited several books, including the recently published 2nd edition of Age-Related Macular Degeneration. And thank you so much for joining
Well, thanks
me
for having
today.
me.
It's a real pleasure to have you. I'm very excited. And may I call you Jenny?
Right, if I can call you Jonas.
Absolutely. So just a little bit of background as we get going here. First, we talked about, I just introduced the idea of OCT, and for my viewers, most of them have not used this. The chances are good that we have a very broad section of clinicians and people in research watching the show today.
Right.
So please help me introduce the subject by talking a little bit about the kinds of eye disease that are going to benefit from this kind of imaging first.
Right. You know, as you said, really the OCT affords us a live biopsy of the eye. So you can actually see the structures of the retina that you otherwise had to infer perhaps by looking through the slit lamp or through a contact lens. And so what we can do is we can actually see the parts of the retina that are swollen. We can see cysts within the retina. We can see areas of fluid underneath the retina, areas of elevation underneath the retina. And then as well as that, we can actually follow patients. So we can get quantitative measurements of how thick is the retina, and then treat them and then follow them up and get another number and see has it actually improved, so is the swelling less. So it's really important for diagnosis as well as for management. And that carries over to macular degeneration, diabetes, venous occlusive diseases, any situation where the retina may be swollen and you're treating and trying to get it to come back down to normal.
Thank you. We're going to go to a commercial break. Right back after this commercial announcement. You're watching In Time TV's On the Edge. I'm Dr. Jonas Moses. Stay with us.